Hi and Assalamualaikum. Today our group will present IHS122 slide for subtopic 4.1 and 4.2, which is occupational health guidelines include biological mosquito control, psychosocial, drug and alcohol, stress and violence health hazards, and Pesticide Act. And I would like to introduce my group members. First one we have Nur Alia Natasha. Second we have Kaironisa Sophia. Third we have Hasbika Sulaika. And the last one we have Nur Isa Inshira. And occupational health guidelines in Malaysia aim to protect workers from health hazards that can affect their physical, mental and social well-being. These guidelines cover biological hazards, mosquito-borne disease, psychosocial risk, substance abuse, stress, and workplace violence to ensure a safe and healthy working environment.
So in this slide, I will discuss about the types of health hazard covered. This slide explains the biological health hazard found in the workplace. These hazards include exposure to bacteria, virus, and fungi and parasites, which are commonly present in the healthcare facilities, laboratories, waste management and agricultural sectors. Example of this is caused by biological hazard include COVID-19, hepatitis B and tuberculosis. And the next one we have mosquito control. Mosquito can transmit diseases such as dengue, malaria and Zika, especially in high-risk areas like construction sites, plantations and places with stagnant water. Therefore, proper waste management and eliminating mosquito breeding areas are important preventive measures. This slide focuses on psychosocial hazard, which involve mental and emotional well-being at work. Factors such as poor work-life balance, excessive workload, and workplace bullying can lead to stress, anxiety, depression, and burnout. It also covers drug and alcohol hazards, where substance abuse can impair judgment, increase accident risk, and reduce workplace productivity and safety. Lastly, stress and workplace violence are discussed. Stress may result from long working hours or job insecurity, while workplace violence includes verbal abuse, threats, or physical assault, all of which negatively affect employee well-being. So, how this guideline protect the community? They promote early prevention and health monitoring, reduce workplace accidents and occupational disease, and encourage employers and workers to take responsibility for safety. By improving awareness and compliance, these guidelines also enhance productivity, improve quality of life, and support a safer working environment and public space.
Next, in this slide, I will explain about weakness of the guidelines. So one of the main weakness is the lack awareness among workers, where some employees do not fully understand the guidelines or their importance. There is also poor enforcement and monitoring, causing the rules to be ignored or not followed consistently. Limited training and education reduce workers' ability to identify health risks and respond properly. In addition, insufficient resource and budget make it difficult for organizations to implement effective health and safety programs. Lastly, low reporting of stress and violence occurs because workers may feel uncomfortable, afraid, or unsure about how to report these issues.
The first case study that we are going to talk about is biological hazard by healthcare workers Malaysia. Background: Ministry of Health Malaysia recorded 5,617 occupational safety cases among staff, including industrial injuries and biological exposure. The issues is biological hazard, exposure to blood-borne pathogens, and the lack of proper PPE and training increase risk. The impact on health and safety is risk of infection, hepatitis B, HIV, and potential heart complication. And for the action and recommendation, we implement PPE usage, proper waste handling and immunization programs. And the second one, conduct regular training and hazard awareness for staff. The second case study is about drug and alcohol by factory worker accident Malaysia. Background:
worker-operated machinery under the influence of alcohol. The issue is drug-alcohol impairment created safety risks for self and co-workers. The impact on health and safety is accident cause injury and equipment damage. And for the action, we enforce drug and alcohol workplace policies and conduct routine screening and awareness program. Next is about stress-related hazard by call center employees Malaysia. Background: call center employees face excessive workload and high performance targets. The issue is psychosocial hazard, burnout and chronic stress, and it can reduce productivity, absenteeism and mental health issue. For the action and recommendation, we promote work-life balance, provide regular breaks and implement stress management programs, and monitor workload and provide mental health support. Next is violent at workplace hazard by healthcare worker assault Malaysia. Healthcare worker was physically assaulted by a patient's relative. The issue is violent hazard and emotional trauma in the workplace. And the impact on health and safety is physical injuries and mental stress. And we are gonna implement workplace violence prevention policies and provide staff training, reporting system and security measures. The last case study is psychosocial hazard by workplace bullying Malaysia. The background study involved 5,235 employees from 47 organizations. About 39% experience workplace bullying. Bullying include humiliation, intimidation, and repeated negative acts. And the issues is psychosocial hazard, such as bullying, work stress, and victim had higher psychological distress than non-victims. And the impact on health and safety is bullying can lead to mental stress and increased risk of psychological injury. And we are gonna implement anti-bullying policies, reporting system and psychological support, and strengthen awareness and support system for employees. Next is conclusion. Occupational health guidelines play a crucial role in protecting workers from various health hazards, including biological risks carried by mosquito disease, psychosocial issues, and substance abuse, workplace stress and violence. Failure to manage these hazards can lead to increased illness, reduced productivity, mental health problems, and unsafe working environment. Therefore, a comprehensive and integrated approach to occupational health is essential to ensure employee well-being, maintain workplace safety, and support sustainable organizational performance. And the last one is recommendation. Employers should implement regular health risk assessment and establish clear occupational health policies covering biological hazard, mosquito control measures, mental health support, and substance abuse prevention. Preventive actions such as workplace hygiene, vector control programs, health education, counseling services, stress management initiative, and violence prevention strategies should be strengthened. In addition, continuous training, effective reporting system, and strong management commitment are necessary to promote a safe, healthy, and supportive working environment.
Hello everyone, today I will be presenting about the Pesticide Act 1974. The Pesticide Act 1974 is a Malaysian law that controls the use, handling, storage and disposal of pesticide. The main purpose of this act is to protect workers' health, public safety and the environment from the harmful effect of pesticide.
This act is very important for occupational safety and health (OSH) because pesticide can cause serious health problems such as poisoning, respiratory issue, and skin disease if not handled properly. By enforcing this act, safer worker conditions can be ensured, especially in agriculture and industrial sector. This slide explains how the Pesticide Act controls the use, handling, and disposal of pesticide. First, under Section 15, pesticide must only be used according to approved conditions to prevent harm to human and the environment. Next, Section 12 focuses on handling and labeling. Every pesticide container must be properly labeled with clear instructions, safety warnings, and storage information. Then, under Section 16, only licensed and trained persons are allowed to handle and apply pesticide. This ensures that pesticides are used safely and correctly. For disposal, Section 21 states that pesticides and their container must be disposed of in a prescribed and safe manner to avoid environmental contamination. Lastly, Section 20 allows authorized officers to conduct inspection and enforcement to ensure compliance with the Act. This slide focuses on pesticide use for insect control and their side effects. Under the Pesticide Act, insecticides must be registered before they can be sold or used. The Act also controls the import, manufacture, sale, labeling, and packaging of these pesticides to ensure safety. The use of pesticide can cause several side effects if not handled properly. These include skin and eye irritation, headache, dizziness, nausea, and respiratory problems when inhaled. Improper handling can also lead to poisoning, and long-term exposure may have serious effects on human health and the environment. Therefore, following the Pesticide Act is essential to reduce risk and ensure safe pesticides use.
Pesticide cases, which is Malaysian school exposure case. In Port Dickson, Malaysia, a maritime pesticide spray drifted from nearby farmland into a school while students were taking exam. Around 283 students were exposed and 30 of them showed symptoms like nausea, vomiting, dizziness, and breathing difficulties, requiring medical treatment. This shows how poor control and human error during pesticide application can affect children's health even when they are not directly handling chemical. Secondly, national pesticide poisoning data between 2006 and 2015, Malaysia National Poison Center recorded over 11,000 pesticide poisoning cases. Many of these incidents involve herbicides and agricultural insecticide, and most were due to intentional engagement or improper use. This highlights that pesticide poisoning is not rare and can be a serious public health issue. So here are the conclusions. Overall, the Pesticide Act 1974 support occupational safety and health, which is OSH, by regulating the registration, use, handling, storage, and disposal of pesticide. This helps to control chemical hazard, reduce workers' exposure to toxic substances, prevent occupational poisoning and long-term health effects, and ultimately ensure a safer, healthier, and more controlled working environment in agriculture and industrial workplace. That's all.